since I have been doing video content on various platforms, the one constant that I've experienced is that there are people from foreign countries that follow me. Obviously, United States. There are people from other countries that follow me that are forever mesmerized by the United States healthcare system. How fucked up it is, how expensive it is, how utterly disgusting it is. And here are some more examples, just really quickly.
I want to know what the fuck I'm paying United Healthcare for. $138 every single week comes out of my paycheck to pay for my health insurance. I am a single woman who's relatively healthy. I'm paying damn near $600 a month for healthcare just to go to the doctor's office, and I had a copay of $125 at a gynecologist well woman exam, a preventative exam, which has never been more than $50 copay in my entire fucking life. It has never been that much. I went to a dermatologist. My copay was $100 there. I just went to go pick up medication that every single time I've ever picked it up was $0. I just had to pay $40 for it. What the fuck am I paying you guys $600 a month just to still have to pay out the fucking ass for everything that I'm getting? What the fuck is up with that? You guys are pieces of shit.
There you go. Now, just to give you my own personal viewpoint, we also have United Healthcare, and since we're self-employed, we don't have employer-based health insurance, and we have to pay out of pocket for our health insurance. So, I'm gonna give you my numbers, our numbers, just to have the insurance, just to have it, about $1,800 a month for the family. Okay, now. Our insurance then covers, if you go to see your regular physician, $50 is what you pay out of pocket every time. Yes, on top of the monthly premium to have the insurance, you pay these expenses. $50 to go see your regular general practitioner, $100 to see a specialist, cardiologist, dermatologist, allergist, ophthalmologist, optometrist. $100 to go see one every time you go see one of them. If you want a virtual care visit, $75. Now, on top of that, we have deductibles. We have an individual deductible annually that has to be met before major shit starts getting paid for. So an individual deductible is $7,500. The family deductible is $15,000. Then you have an out-of-pocket limit. So your annual deductible, here I'll read it right from the website, is the amount you pay for covered services before your plan begins to pay. This includes medical, pharmacy, and children's dental and vision care. Each covered person must meet their own individual deductible until the family deductible is met, so that you guys understand what we're dealing with. Then there's an out-of-pocket limit. Your out-of-pocket limit is the most you pay for before we begin to pay 100% of the allowed amount. This includes all payments that you make for covered medical, pharmacy, and children's dental and vision services. Each covered person must meet their own out-of-pocket limit until the family out-of-pocket limit is met. Individual out-of-pocket limits are $9,200. The families is $18,400. I know people in other countries right now are shitting their fucking pants. Like, dude, how? On top of all of that, they can and do deny services. That one's not covered. Now, that's something that Obamacare was trying to fix and went a long way towards fixing, and something that the Republicans want to do away with. Now, I'm going to show you another video from a couple that just had a baby. Watch this.
Here's how much it costs to have a baby in America.
More specifically, in Nashville, Tennessee.
So we're going to start with the ultrasound that we had to get a couple days before Aspen. So that ultrasound cost us $2,067.85.
Just to make sure the baby was okay. And
now onto my actual hospital stay. So we stayed for just under 3 days.
So whatever the observation room is, we got charged $413.65. No clue what that is.
My guess is maybe triage. You know, they were observing me.
The recovery room cost us $2,702.45. A hospital stay, I don't know how that's different, but that one cost us $4,438. The emergency room cost us $1,932.90. And I don't know what the laboratory is either, but that cost us an additional $1,439.20.
The only thing I can think of with the laboratory is like maybe like my IV that I had. I don't know. But then we go into labor and delivery. So this one is the one where I would expect it to be the most expensive because that's clearly why we're there. We got charged $10,593.40 for that one. And then our anesthesia. So my epidural cost us more than anything else. That one was $14,446.15.
Was it worth it?
Yes. Yes. We also had a pharmacy and supply cost. So pharmacy cost $2,007.25. For supplies, $565.03. So the grand total for everything came out to $33,011.73.
But that was just for our stay. We also had to pay for Aspen, our newborn daughter, to be in the hospital.
So her hospital stay, to stay with us in the room that we also paid for, was $4,008.
Our complete hospital bill cost $37,019.73.
Luckily, we have insurance, but insurance only helps so much. So how much we have to pay out of pocket to have a baby in America is $11,558.93. Was it worth it? No, I'm just kidding. I'm kidding. Yes, it was worth every penny.
Mm-hmm. We pissing our pants yet? If I could quote Negan. It's fucking disgusting, man. It makes you want to fucking drink. That is how we get our health care in the United States of America. Some plans are better than others. Some plans are worse than others. But you do not go see a medical professional in this country. More times than not. You do not go see a medical professional in this country and not hand them money in some way, shape, or form. That's not how we do things here.